the University of Texas Health Science Center, President Feely. And President Feely, I would ask you make the presentation for both at the same time.
I'd be happy to.
So
Thank
the
you.
members can ask questions.
You bet. Thank you, Mr. Chairman, and thank you, esteemed members. I'm Julie Philly, and I've proudly served as the president for the UT for the University of Texas at Tyler since June of 2024. Despite having a lot to learn, I want to tell you this has truly been the honor of a lifetime. UT Tyler is committed to help the needs of Texans by educating and training the workforce through high-quality, high-demand programs. We exist to serve others and to make a difference in the lives of our students and our patients. The University of Texas at Tyler and the University of Texas Health Science Center at Tyler entered into an administrative alignment in January of 2021. This alignment provides a fully integrated academic medical setting. However, it did not change the two institutions' state budgeting and appropriations process. This presentation is specifically geared to our general academic institution. I'm proud to report that our enrollment and academic programs at UT Tyler continue to grow. This fall, we celebrated record enrollment with more than 10,500 students, and we offer almost 100 undergraduate and graduate degree programs through our 5 colleges and our 3 schools. Celebrating 50 years of service, our School of Nursing is among the top 5 largest nursing schools in Texas, and our graduates average a 95% pass rate on state licensure exams. Thanks to the generosity of the 88th Legislature, we have established a strong and sustainable critical care nursing workforce training program to address both regional and statewide healthcare needs. This initiative, now entering in its second biennia, is designed to respond to the crucial workforce needs in Texas, especially in our rural regions, such as critical care nursing, flight nursing, which is the only program of its exact kind in the state of Texas, and starting this fall, a certified registered nurse anesthetist program in Tyler, Texas. The Benham Métis Fish College of Pharmacy was founded in 2013 in response to a need for more pharmacists in East Texas. Again, we are incredibly grateful to the 88th Legislature for the formula funding support that will begin in the 25-26 biennia. This funding has allowed us to bring our tuition rates in line with other public institutions and increase our enrollment. Last year, our graduate pass rate on the national exam was 4.3% higher than the national average. As I mentioned, we are committed to meeting the workforce and the healthcare needs of our region and the state, so we've dedicated resources to programs that prepare our students for career success. I'll now highlight our requests that will help us accomplish that mission. UT Tyler is seeking a new non-formula support item to address the critical education workforce needs in the region. We are requesting $4.8 million for our East Texas Teacher Training Initiative designed to help address the state's critical shortage of classroom teachers. Following the work of Governor Abbott's teacher vacancy task force, we want to expand teacher training opportunities to increase the pipeline and improve the training for new teachers. UT Tyler currently enrolls approximately 300 undergraduate education majors each year. With item funding, we plan to significantly increase the number of undergraduate students in traditional education programs and launch new accelerated programs targeting dual enrollment high school students and currently employed school paraprofessionals. By implementing 3 starts per year for teacher preparation programs, we can provide better flexibility for students and meet people where they are. We respectfully, like other institutions, request the reinstatement of institutional enhancement funding. Critical to UT Tyler's student success initiatives, this money is used for students and to help with things such as program scholarships, supplemental instruction, technology, and library services. These resources support students' successful completion of courses and a timely graduation. And finally, we request continued support for our non-formula support items, which are essential to sustaining and expanding educational and healthcare initiatives across our region. Those items are our Longview campus funding, Palestine campus funding, and our School of Nursing critical care nurse training pathway. In closing, for the general academic portion of my presentation, we are absolutely committed to educating a highly skilled workforce in Texas. We are focused on our student success, and we are extremely grateful for your support. I'll now move into with your instruction to switch gears towards our health-related institution. The UT Health Science Center at Tyler is the only academic medical center in Northeast Texas. Our mission is to serve Northeast Texas and beyond through excellent patient care, comprehensive education, and research. UT Health Science Center at Tyler maintains a portfolio of clinical and non-clinical operations, an acute care hospital, inpatient and outpatient behavioral health services, a network of regional outpatient clinics, a rapidly growing faculty practice, and many GME programs, including a biomedical and clinical research enterprise. Since 2018, our clinic operations have worked in a partnership with 9 other regional hospitals known as UT Health East Texas Health System to enhance educational opportunities, improve health outcomes, and train our workforce. In response to physician shortages, the legislature approved a medical school at UT Tyler. Since approval, classes of 40 students each year have enrolled in June of 2023 and 24. Admission to the program is highly competitive, and the first 2 cohorts were selected from a pool of more than 8,000 applicants. We're proud to report that of the 80 students that comprise the first and second classes, over 90% have East Texas roots. Our new medical education building, located in the heart of Tyler, is on track for completion later this year and will be the home to our School of Medicine. Residency training, as we've discussed today, plays a crucial role in where physicians choose to participate. Texas has led the way in making significant investments in GME to strengthen the workforce, and this is a very vital part of our mission and our vision. Since 2020, we've expanded from 5 to 20 programs, a 300% increase in just 4 years. Our medical school actually started after our GME programs had been in existence since the 1980s. One of the largest areas of our focus also is in mental health, and we appreciate your support in our mental health training programs. Our psychiatry residency program currently trains 40 residents in general and in rural psychiatry. We have 4 child and adolescent psychiatry fellows and are awaiting accreditation for a forensic psychiatry fellowship. This is in addition to our psychology doctoral trainees. We are also honored to partner with the state to supplement the state hospital system by providing 44 inpatient behavioral beds, 30 residential, and 14 acute care, as well as 30 more private pay beds for our community. Our Health Science Center serves as the East Texas hub for the Texas Child Mental Health Care Consortium. 2 initiatives of the consortium have provided thousands of consultations, as well as support to our school districts through telemedicine and suicide prevention. And we are also excited about a new joint venture partnership with Oceans Behavioral Health that will allow us to further expand behavioral health inpatient services in East Texas. I would like to highlight our budget priorities that will allow us to continue delivering our promise to provide excellent patient care education and research. East Texas faces numerous shortages in the healthcare fields, including in rehabilitation. To fill this gap, we are seeking startup funding of a $4.5 million for a comprehensive clinical rehabilitation sciences initiative to include physical and occupational therapy, speech-language pathology, a comprehensive dementia program with a Parkinson's disease and movement disorders program to address the rehabilitation needs of these patients. This initiative allows us to increase the number of high-quality, high-demand clinical academic programs. Texas Health and Safety Code 74.603 designates the UT Health Science Center as the state chest hospital. We are the primary facility in the state to conduct research related to respiratory diseases, deliver diagnostic and treatment techniques and procedures, and to treat respiratory diseases. We're grateful to the 77th Texas Legislature for creating mission-specific funding to recognize these patients, as well as our institution's designee as the state chest hospital. Continued funding for GME expansion at the Texas Higher Education Coordinating Board, as well as mental health funding, is crucial to our mission. Funding these programs allows program growth and sustainability. The UT Health Science Center exists to train the next generation of healthcare workers and to treat patients. We have dedicated our time and our resources to high-quality, high-demand programs meeting the needs of our region, and we humbly request your support, your continued support, and thank you for all you've done for us. I'm happy to take questions.
Any question, members? There are no questions. Thank you very
Thank
much
you.
for your testimony. Next, we have the Stephen F.